In our last station, we will talk about blood supply, venous drainage, and innervation of the heart. Regarding the blood supply of the heart receives its blood supply from the ascending aorta via two main arteries, right coronary artery and left coronary artery. The right coronary artery originates from the ascending aorta from the aortic sinus just between the pulmonary trunk and the right auricle. Now this is the right coronary artery. Down its way, it gives of right coronal artery to the infundibulum of the pulmonary trunk. Also, it gives a marginal artery. The marginal artery supply mainly the right ventricle and run towards the apex of the heart. This is the marginal artery. Right coronary artery also give 2 to 3 branches called anterior ventricular artery to the right ventricle. It also gives atrial artery to the atrium, supplying also the SA node, which is at inferior part of the right atrium. Along its way, also it gives posterior ventricular artery to the right ventricle posteriorly, and it continues its way between the it continues its way at the interventricular groove at the posterior interventricular artery, which runs toward the apex of the heart between the two ventricles and supply mainly the right ventricle and part of the left ventricle and the posterior 1/3 of the interventricular septum. Now let's talk about the left coronary artery. The left coronary artery is the main artery and supply area larger than the right coronary artery. Again, it originates between the pulmonary trunk and the left atrium. Upon its origin, it gives left coronal and diagonal artery that will supply the infundibulum and gives two main branches. The left anterior descending artery, which runs between the two ventricles, and the circumflex artery, which turn back to the posterior surface of the heart. Now, the left anterior descending artery gives of anterior ventricular artery to the anterior surface of the left ventricle and continue its way to the apex of the heart. Note that the left anterior descending artery pass backward to the heart to anastomose with the posterior interventricular artery. Now the circumflex artery, which turn to the back. Okay. Those are the anterior ventricular branches and the posterior ventricular branches of the left coronary artery. The circumflex artery, as it turns to the back of the heart, give off also left marginal artery, which supplies the left margin of the heart. The circumflex artery also gives posterior ventricular branches to the left ventricle and also atrial branches to the left atrium. Atrial branches to the left atrium and posterior ventricular branches to the left ventricle. Marginal artery and the circumflex itself, left anterior descending artery, coronal arteries, and anterior ventricular arteries. This is regarding the arterial blood supply of the heart. Now we came to the venous drainage of the heart. Most of the venous drainage of the heart came at the coronary sinus, which at the posterior side of the heart at the interventricular groove as a continuation of great cardiac vein. Here, the coronary sinus lies between the entrance of the inferior vena cava and the area of the atrioventricular valve of the right atrium. So this is the anatomical position of the coronary sinus, and this is the anatomical position of the great cardiac vein. The great cardiac vein also receives blood from the small and middle cardiac vein. Anterior side of the heart came the anterior cardiac vein, which drained directly into the right ventricle. We will demonstrate it at the model in details later.